Good morning, everyone.
Good morning.
How's everyone doing today?
Fine, thank you.
I'd like to welcome all of you to the City of Rio Blue Ribbon Committee for People with Disabilities. This is the October 16th meeting. And so I'd like to start. I'd like to call the meeting to order. And the first item, or the second item rather, is the approval of minutes. You should have the minutes on your immediate right. The meeting for September 18th, 2024. Take a few minutes to look at them.
So I'm gonna put it up just to give time for it. Send the invite to here and it goes, and you get it in your terminal through 10th Street. And then she referred it. You're calling? Let me know exactly the day. And that just happened this morning.
Good morning, Cecilia.
Good morning.
We heard all your conversation.
I'm so happy. Any concerns with my minutes?
No, I think we're good.
Okay, good. I'm getting good at
You're
this.
getting good.
I just,
So
just
any-
on the, I'm sorry, on the minutes, just so it can reflect, I was present, on September 18th.
I'm done.
Did I not put you there?
No.
No, that's fine, I just, I was here, so we verified the signage.
I wasn't.
You don't wanna get, you don't wanna get a call from Mr.
Yes.
Get another.
You
I
get,
wasn't here.
you get taken to the principal's office.
We'll let you on.
So we just need to make that correction? Is that the only one?
Yeah, cause the tops.
For the date on the disability, the employment opportunities for people with disabilities, was it October 22nd or October 2nd? Because here it says October 22nd. It took place October 2nd, right?
Instead of the 22nd.
Yes.
Okay, I'll make a change on that one too.
Okay.
With the eyes.
No call, is it call messy? Kidding.
We're fine, as long as we're catching the issues.
You did a great
We're
work.
good, we're good.
So we have 2 corrections, right? That's it?
That's it.
Changes?
That's it, so
So the health fair, is that the one we just spoke about, October 26th?
No, it was the employment opportunity event, the symposium that was held at the UT.
Okay, that's the date.
The date was October, that's the 22nd and 2nd. No, but, and then,
Oh, I'm sorry?
Do I have internet access here?
I don't think we have Wi-Fi, no.
Okay.
We do, but it gets the whole process.
Any other changes?
I can actually bring you. Deidre, do you have your mic
I
back?
was about to say,
You can connect her to mic back.
Yes, definitely. What is your number? Are you?
So with those two changes, you will be, can I have a
Yes.
motion to approve the minutes in a second?
Donna approved.
So minutes are approved, as long as we make those corrections.
Who second that?
Any public comments?
public comments, no public comments.
We move on to the next one, discussion possible action regarding the following. Committee website, revision and updates. You know that this has been on here for a month or two. I don't know if, some of the revisions have to do with including updated photographs as well as other, I don't know if all the members were listed.
Everything's been updated, everything that has been sent our way has been updated.
are we missing any pictures?
Yes.
We are missing a few on there, yeah.
Yes.
But, we're just waiting on them to send it over.
I guess if anything, Mr. Castellano, we can do a final call for changes for this meeting. And, next meeting we'll have the TV set up for you guys, and we'll make sure that you review it during your meeting to do kind of a final approval.
Yeah, that'd be good, thank you.
Okay, thank you.
My concern was only to make sure that the links we provide to the
Right.
public are updated and functional, but you assured me that we're good.
Great. I think I should have sent like my work as opposed to,
The next item is the discussion of possible action on selection of the BRC logo.
So that's, at least it. that's the
And
new-
Mr. Chair, I believe that links were sent out to committee members to do a vote. Our amazing, I don't know, is Deidre here? I'm like, I saw you and you left. And Jaime, have worked very, very hard on, putting their talents, you know, into several logos. It was a hard call, I think there was a lot of good ones, but there was one that, well, I'll let Jaime explain, but, yes, go ahead.
Yeah, so the survey pretty much showed us that, or not the poll, that was the final result, that was the most, that was the popular one, that,
The most voted.
the most voted one. Yeah, so, leave it up to y'all to vote on it.
So, other than if this was the most voted on, is it still open for some edits?
Sure,
Okay.
of course.
If it's open for some edits, I only had a question. I noticed that all the designs, they were, I thought they were great. It was hard to choose. But I had one question, why are they all blue? Is there a reason for that? Sometimes you choose a color for
Yeah.
a reason. Is there a reason for blue?
Yeah, I believe that was the colors from before, right, Deidre? Yeah, the old logo, we just based it off on the old colorway. But we can, that's up for change as well. Whatever you like us to change on this template, we can.
Open to suggestions, whatever.
Yeah,
The committee,
suggestions.
the blue ribbon committee thinks.
Mine is only the one with the I where it's crossed out, right? I don't know if we do somebody with a white cane or something,
Okay.
Or just not put the X there, perhaps?
well,
I like the cane, I like the idea of the cane.
Yeah,
right,
Yes, yes.
because that way you
A
know
white
it's
cane,
a
yes, you can
line,
associate
right?
it. Go ahead.
I know, but I think that this kind of limits like, what about autism, what about,
The
Down
unseen,
syndrome?
the unseen
Yeah, like Down syndrome.
disabilities.
You get me, like, these are the most visual ones.
It
But what-
cannot really, I don't think we could ever include everything, right?
No,
But you know, we can reconsider which we have.
If you look at the one with the hands, I mean sensory, you know, you could say that, manipulative, you know,
Or
fine
you
motor
could say
skills.
sign language, or you
yeah,
could
that's how we
say-
read it, sign language.
Or you could say, yeah, sensory.
Or maybe like this I, like Diana was saying, you know, maybe, you know, like the X, we thought, okay, well, maybe that's unseen, even your unseen disabilities. Maybe work on that.
Something more universal.
Well, why can't we use that more universal, it's inclusive, or inclusion for everyone? Hands or something instead, just.
Well, there are the
instructions
hands
for-
kind of rooted on,
And leave out the symbols,
So,
just put hands. For inclusion, I mean,
You
but there's a
also-
lot of, there's a lot of disabilities, I mean.
Yeah.
It's,
And there's those that are unseen, so that's what, you know, she thought, okay, maybe that's what the X is for, but, because I agree, I really don't like the X on it. I don't
Maybe
know.
it has a negative connotation.
right.
I agree. But, I see what you're saying.
symbols out of it.
You know what I mean?
Yes.
Leave the hands like this.
So we take off the symbols and just leave the hands, that could be a suggestion as well.
I think so.
The hands. And nothing in the middle.
You know, if I'm not mistaken, if you look online, I don't know if it has the capability to look online, but I wanna say when we were looking before at the different symbols for the different, disabilities, I wanna say that the two hands like that with something else in the center, I don't quite remember what it was, but I believe that that's the one that was chosen by the International AU Society or something, when I was looking it up. I remember the two hands. But we need to look online to review symbols for AU.
You know, one of the things that I wanted to also bring up, I work with individuals who are colorblind.
Uh-huh.
The blue is a pretty good center color, so, and maybe when we do post something online, any symbols or anything, consider that when we're looking at the color blindness, because we do have a population that does have that. So they'll be able to read it.
Great point. So when we've done several logos, so this is the initial template, and then after that, we'll push out all the other colors. So black on white, white on black.
They'll
Push
do
out.
like a high contrast
Yeah.
one, they always do with any logo,
Yeah.
so that there'll be a higher visibility. I know I saw them too, but what's coming out for me now, Jaime, is that we just put Blue Ribbon Committee. I know it's an inactive one, but there was another Mayor's Blue Ribbon Committee, so I think we do need to decide
For
whether
people
this is
with
for people with
disabilities,
disabilities,
yeah. Cause there are other blue ribbon committees.
We'll put it in the middle, with people with disabilities. Oh, wow.
Oh, yeah.
Yeah, right here in the middle. I put it right here with people with disabilities. The word. And it covers.
Yeah,
Oh,
'cause
yeah, that's
Very good.
good.
And that would be
Inclusive,
cute because
inclusive, anything that has to do
the way
with-
that it might be read is
Yeah.
the City of Laredo People with
sensory
Disabilities Blue Ribbon
issues.
Committee, so that's kind of like
So,
their.
The actual name, so you would leave, I would recommend leave the city of Laredo and then Blue Ribbon Committee and then just on the bottom in the bigger ribbon, for people with disabilities.
But it's
Right.
for people with disabilities.
That includes a lot.
That covers everyone.
So there was another one at the top.
See, there are other.
There was another one that, no, it's active,
That's a-
from what I
yeah.
recall,
Autism.
don't quote me on it
Yeah,
either.
that's really
My
good.
brain is full of things right
No,
now.
I'm sorry, there is. Yeah, it is, but there are other mayors
Oh,
or committees for other, I don't know what
But I like the way the
alcohol.
For other organizations.
Yeah,
Sorry.
right?
And I think also it'd be important to
That
note
includes
to
everything.
include people with disabilities
Let
in
me
the
just show you.
logo,
Okay,
to also make reference to like the governor's committee for people with disabilities, how we're kind of the.
Yeah.
No, I got it. You're-
Just
you
so
got it.
everybody
I got it.
knows.
Let me see.
Put your ideas out there and then we'll look
A
at
ver,
it.
mami.
Oh, yeah, that
We
one's
can look at
cute.
it.
So,
See, like this one, because she asked.
it has the, show it to Dr. Ruth Inger. Got the brain in there.
That can be
And
all.
that way it covers all.
I like that one.
Yeah,
I
I
see
see
that
that
one.
one there. Let me show her.
Instead of the
Well, instead of the eye, you could put somebody for the blind, and somebody walking with a white cane, right? And then for that one, if you're not the ad, one in here somewhere, maybe here.
Is your opinion?
With the
Oh,
blind,
look at it like
the
that.
unseen, right?
Like the name, like the people with disabilities working out here with their hands.
I know, but it could also be the.
Make it simple.
Yeah, because we're all the same wavelength.
Don't criticize my
Yes,
art,
and that would
but
include-
we can pass that along and see. I mean, yes, yeah, right?
Yeah.
It's easy read and understood.
It's really nice, it just needs some tweaking. It's really
Yeah,
good job.
everybody, yeah,
This was more traffic.
yeah.
Erica,
No.
did you see all?
Well, the only objection I have is that
Oh, hello.
some individuals.
Oh, okay, yeah, I think it would just be a printing thing. Oh, that's cute too.
That one.
He, and like, my opinion is this one, that is
Oh,
wheelchair
yeah.
access and you're Down syndrome.
Lo que tienes que hablar, porque
Yeah, yeah.
we don't wanna make it
Um,
so busy.
Okay, well,
I don't know, I'd get like
Especially with small,
I'm
you
like-
won't be able to see
So-
the.
If I may suggest something,
Yes.
these are all great ideas. Why don't we create three different versions of this and then revote?
yeah.
That
And
sounds
which-
good.
Whichever one
That way we can.
you all vote on, then we
Yes,
can, you guys
that's
can
great.
motion on it.
Yes.
Okay, so
Thank
this
you.
is one, instead of the three little circles, you'll put the wording, people with disabilities, in between the hands.
Okay, so kind of curving up.
Yeah, curving
Yeah,
up.
Okay.
like saying that you have it here, it would just be people with disabilities.
Okay.
Yeah, and then whatever other options.
Yeah, I have.
I need to excuse myself for just 1 second.
Again, but by the same token, if you wanna do that in the right smack in the middle,
I would,
Then
I
put it in the
honestly,
bottom.
yeah, I honestly think, cause the whole name is Blue Ribbon Committee for People with Disabilities, why do you wanna break that up?
No.
yeah, I
Well,
just.
but
I think it goes here on the ribbon and you just bring the ribbon down and add, cause that's the complete name, why are you gonna mess with this?
Yeah,
My
much more
opinion.
room for the
Yeah,
other
and here,
symbols.
then you're just gonna put, cause you can need to add one more symbol, right, we agreed the
brain.
brain,
Oh.
to cover all the.
Like learning disabilities.
Yeah, so if we just put it under here, the ribbon committee for people with disabilities, that's the complete name of the committee.
Yeah, we're
Because if you're
breaking it up
putting it
into
up
two
here,
pieces.
you're breaking up the name,
You're right.
right?
That's true.
Okay.
Miss
That's just a recommendation. But if it was.
Where did you buy the coffee from?
I don't do coffee because I'm already naturally like this, I keep flying around the room.
We're not done.
No.
Okay, very
So I only have two suggestions.
Yes.
I agree with the ribbon thing, cause I told
That
Dr.
should be
Ribbon earlier, that shouldn't be moved. That
Yes,
should
I
be-
agree with you.
So I'm in agreement with that. The item on the left, the one with the X, is that supposed to be a walking cane?
I don't want that.
You mean to change it?
No, it's like you don't see, right? That's what the X is for blind.
Right.
But if we put somebody with a white cane, that'll
So
send a
can we
message.
do something like a human walking with a cane?
Yes,
And I'll show
that
you
was the
picture.
recommendation.
And then we'll do the other one with the
Yeah,
with the
And
brain.
the other
So
one
one
is
with
the
a cane.
head with the
Yeah,
brain.
the one with the
Yes.
So you're gonna add 4 bubbles.
Yeah.
The one with the cane and then the brain.
No, the one
No, no,
with
no.
the cane is gonna be, it's gonna
It's
take
gonna
the
replace
place
the-
of.
That's how you're gonna
Ah,
use
right.
that one and then add, so it's gonna be
And then
4.
you're gonna add the one
Yeah.
with the head and the brain.
No, no, no,
You're
so,
gonna have
yeah,
four.
okay, okay. It's gonna be 3 circles.
No, 4 circles.
But anytime you design, he's right, it should be 3s or 5s.
Yes.
Anytime you
Not
have to
even.
Because
design.
you kinda throw off the
It'd be too
design.
much.
Oh, so.
So what are you gonna do?
So
Get rid
which
of the
one
hand and put the brain?
Which one are we
I-
gonna replace?
I think it should stay as 3 and then find 3 universal
Designs.
designs that you all think. Because
Okay,
if we push it to 5, it's gonna be way too much.
yeah, I'm too busy. Okay, so then we agree that the one with the eye will be the one with the
With the
cane,
cane,
okay?
yes, ma'am.
And then we're gonna leave the wheelchair, right? And then the one with the hands, do we put the brain there?
Yeah, we could.
Yeah.
For anybody with, you know, the unseen, I don't know.
So
No, that one, yes.
So the hands as they're displayed here, what's the assumption that it's conveying?
Deaf. Deaf mute, that's how I saw it.
Sign language.
Yeah, sign language.
Sign language, braille, anything with the hands function.
Is that what it was?
You know,
Yeah.
one of the things to think about, and I'm just throwing it out there, is if you're a special educator, you understand how many people there are with the specific disabilities. And Jaime, which are the low incidence?
The low incidence.
Low incidence disabilities.
Yeah, those are your kids that are very medically fragile.
Medically fragile, hard of hearing or deaf,
Yeah.
visually impaired. The majority of people are people who have invisible disabilities. For example, if you see a population, the people we serve in the public schools, the vast majority have those invisible disabilities. So the low incidence disabilities include hard of hearing, blind, deafness or blind, hard of hearing, those kinds of
Deaf mute.
yeah, those are low incidence. The higher incidence are the ones that are, as you stated, non-visual. Like, for example, vast majority of the people we serve in special education are learning disabilities. Do you see those? No,
No.
you don't. But are they there? Yes, they
Yes.
are. So, I just throw that out there when you're
No,
considering
see, yeah, that's.
the symbols. It's up to you.
So
Then you're gonna bring back some,
it'll be the brain.
designs, right?
Yes.
The brain,
the cane,
the cane,
and then for people with disabilities in the bottom.
Yes.
Okay. We agree?
but, okay, so, the eye, so you're gonna bring, cause again, it could take, double, what's the word, connotation, maybe? If you just leave the eye without the X, that could also be seen and unseen, except without the X, you get me, like, you're just looking at somebody. Does that make sense?
No, but
Versus
the
you putting somebody-
brain sends more of that message. Once
Yes.
you put the brain, it's.
Instead of the person with the cane.
No, we need the white cane, cause that's for the blind.
That's what I'm saying, that's what I'm saying, because you're replacing.
You're gonna get rid of the eyeball and you're gonna put the white cane.
Yes.
Somebody walk the white, so that'll cover the blind.
Yes.
And then you've got the wheelchair, right?
And so then the hands are the ones that are gonna be replaced?
The hands and the eye, with the brain
The
and the
eye
brain.
with a white cane and the hand with the brain.
And you're just gonna keep the three bubbles?
Yeah, I think so.
Okay, well, it gives you guys,
This is
updated.
kind of universal.
Yes.
Yes.
See, and I
Just
saw
throwing
the
it out
eye
there.
as universal.
Yeah.
Just throwing it out there, that's kind of universal, isn't
Yes.
it? That's what we saw, we've always seen in the parking
And
spaces.
and worldwide.
Yes,
See that.
it's very
Yeah,
much
for this
worldwide.
So it's universal, are you saying for us to eliminate it?
No, I'm just saying, because we're talking about, are we all encompassing, are we included everything? Are we
Yes.
included
But I think with the brain, that would include,
everybody?
yeah.
There's such a thing as cortical blindness. In other words, that people can't see because injury to the occipital lobe. So it could be would be the brain.
Yeah.
I don't know.
Yeah, the brain for sure, we have to throw that
Either
in
way,
there.
look, Jaime's gonna send us some and then we can make
And
that
then we can
final.
choose, yeah, there you go.
But
Right.
based on this, like, core design, we'll just do,
Yes.
Yes,
like,
you're gonna
I don't know,
tweak it.
another 2 to 3 variations of it, right? We'll vote again
Well-
on it, and we'll bring you the results
Yes.
next meeting for you guys to vote on.
Yes.
Sure.
And
No,
guys-
good job, thank you.
Oh, yeah, it's
Need
beautiful.
your work on it, so.
Oh, here's-
Thank you, Mrs.
Just put me back there.
What did y'all say about the color? We're gonna stay with blue?
Yes,
I would say stay with blue.
I think so.
Because out of this, it'll come out different color
We'll do a high
variations.
contrast.
High contrast.
Okay.
Yeah,
I'm over here voting.
it's okay, bro, you have a voice.
It's very-
You're the cheerleader, remember?
Oh, yes.
No, that I know of. The only one is the puzzle piece for autism that's multicolored. That's the only one.
But I think the brain,
Yeah.
Looks nice.
So, Denise, you work with the Division of the Blind, right? And looking at this logo here, this first one, we're agreeing that we put, instead of this, to put somebody walking with a white cane. Would that send more of a message for the,
I think that would be better.
right, okay,
I agree.
all right.
Yeah, I agree.
Thank you, ma'am.
Yeah, the X is always like a negative connotation.
Yeah, right, like,
Yeah.
it's okay.
Yeah.
All right.
Okay, so, at the end of that discussion, we came to no conclusion.
But it was a good discussion.
It was a good discussion.
Jaime's gonna fix us up.
Yes, yeah, that's awesome.
Okay, so conclusion is pending on that one, okay? So thank you all for all your work.
What to choose.
We run into this problem with the logos that we create, but it's a problem.
Yes, they are.
We should resolve it.
Next item is the presentation, reports and updates, and so Ms. Sanchez is gonna give us a report on the outcomes achieved by the National Disabilities Employment Awareness Month Symposium.
Yes. So I just put some outcomes together here just to share with everybody. So total number of attendees, we had 85,
Wow.
which was a really good number.
It is.
Key partners, employers, organizations represented, of course, public health, UG Education Research Center. So not only did they host us, but they had some of their folks stay, which I thought was great. Vocational Rehabilitation Services, Concentrics was there, Laredo Autism Group, Ruth Bical, AA Vocational Services, Communities and
I
Schools.
saw the director there.
Yes.
For communications and stuff.
Yes. RM personnel, of course, LEAF, Ms. Lisa, LISD, USD Scan, the Blind Children's Program, Asas Health was there, Goodwill Industries, Pan American Courts, Laredo Job Courts, PNC Bank, Laredo College, TAMU, Workforce Solutions South Texas, Westcare, Casa La Esperanza, Laredo Health Promoters, and MHP Salud. This is everybody who, I condensed it of the sign-in sheet, so we get a consensus of who all was there, right? Success stories. You want to talk on the success stories? I think they were fantastic.
They
You and
were.
Erica.
They were.
I happen to know both individuals because I've worked with both of them and they're both amazing. One, I know that the meeting we mentioned, I've known him since he was inside his mother's womb. Even before he was a thought in his mind, I've known the family. and so I asked him, well, how long when I was in my mother's womb? I think that's what I call full circle. You know, we're a small community. We know each other. It really is a lot of satisfaction because I can tell you from speaking to Bo's mom, his location is like they're like a few blocks away from there. It's within distance. Everything is perfect. The right atmosphere, the right location, opportunity for growth exists. VR is waiting for him to re-enter into the program so that we can start looking into the possibility of engaging him in a long-term career. Bo was super excited, especially when his picture came out in the paper. And he went ahead and asked his mom to see if she could, what's it called, post it. So they're gonna put it, frame it and put it up in his room because it means a lot to him.
Of course.
And he says, I really make a difference, right? I said, yeah, you do. He goes, I'm really important, right? I said, very important. and that brings value.
Yes.
Mr. Granados is, I call him the love of my life.
The next mayor.
Yes, the next mayor. As a matter of fact, if I ever call him and you ever pick up my phone, if you look for Mayor Raul Granados, it's right there. Because I tell him that he has walked every single thing you can think of. He has persevered. He has stuck with things even during COVID. He was doing a work experience at the city of Laredo and they shut down. He said, what do I do? I said, well, let's get you involved in taking some public health courses. Had no idea that this is where he would end. He never said no. He took QuickBooks, he took every single thing that this woman made him take. But he was open. He loves working in the health department. He feels valued. He understands that his contributions impact other people. That itself is phenomenal. And I commend the health department for having decided to, you know what, let's engage in a proactive approach to teach the community that it starts here. So Ms. Erica and Mr. Dr. Chamberlain, thank you so much for that, because he is a happy camper.
He is.
And he's very helpful. He helps
Yes.
us with a lot of things, and if we ever have questions, he answers right away. He's like, come to me and I'll teach you, and also he's great.
And I really wanted to navigate the presentation when, we thought about speaking on the success story, and we approached him. He's like, well, I'm not a public health speaker. I'm not a public speaker. I don't want to talk. And I'm like, well, I don't want to talk for you, because I think that a lot of the times with projects like this, with presentations like this, that may happen. Or sometimes, you know, we're so busy thinking of all these contingencies and you know, and trying to over accommodate that we don't hear that perspective.
Right.
And that was very eye-opening to me when, you know, we had another employee that also sometimes required a scooter to get around. And we were at a conference, and we were thinking about where to go to lunch. And here we are talking about where do we go to lunch? Oh, there's this place downtown. Well, it's because downtown, how is she gonna, you know, make it in with, you know, her scooter? You know, and we're here breaking our heads. I'm like, why don't we ask her?
No, that's
Like, hey, we were thinking about this place. Like, what do you think? And she's like, if you help me, if I could take your arm to get up the little step, I can go to that restaurant.
Awesome.
And that was when that will always be in my mind, like burn into my mind, that you won't know. You won't know what's good or what's not good or what's, you know, what they're gonna be able to. And that's the core of inclusion, isn't it?
Yeah.
So when, you know, Raul was like, I really don't wanna speak, I'm like, I really don't wanna speak for you. And I would really like to hear your perspective. And you could go out there and be like, Eric is the meanest boss. And you know what? You are, you know, you're in your right because that's your experience, but you're speaking to your experience. So what I also found that was very beautiful about that event is that his entire team went.
Yeah.
He's part of our fiscal management division, so his manager went and all of his colleagues, and the dynamic that they have, you know, is just so refreshing because they really get along. And past, you know, I also remember last Christmas, he had just come on board and we were doing Secret Santa. So with Secret Santa, we gave out a little form. And like, what do you like the most? What do you like the least, right? And we all filled it out. And for does he like the least, he wrote walking. And like, it, you know, he's able to joke about, you know, certain things. And that also gave, you know, that confianza with his peers, you know, that it's like, it's not something like, oh my God, taboo, or you don't talk through. He's open to conversation and to educating us on, you know, on anything. And when it comes to his work, I mean, I really, if I'm going to accept commendation for anything, is that I picked the best candidate for that position. And that's what I'm most proud of, that he was the best fit. In the interviews we did, there was no special consideration. He knew he had the degree, he had the experience already with City Hall, which he got through Ms. Ceci's programs. And you know, we see the results now, where we have peers at the health department that really do value the work of that unit. So thank you for the opportunity.
He teaches
for
you that different, not less.
Right, well, and I mean, how different, you know?
Well, that, you know, in the
Yeah.
sense that he's, you know, he's in a wheelchair, that's different, but.
And you know what,
we make him any less.
the only thing that was, I guess, an exercise to us is knowing that this is an older building that got grandfathered in, that doesn't, you know.
Accessibility.
Yes, so, and then having the battle with like engineer, architect, you know, folks that are telling me, I just remembered I had a meeting with them a couple of weeks ago, because we're reassessing accessibility in our entrances. We did get some funding from the mayor to make improvements in our current department. And back then we were looking at the motorized doors, which, I mean, those in itself were a challenge. Oh, hello. You know, and just the different access points, how were we gonna work that? And we were looking at how we can improve on that with architects and engineers, and they're like, oh, well, but it's because if you do this, you meet the minimum for ADA. And I'm like, I'm not here to meet the minimum. I'm here to make my building accessible.
Accessible to people, yeah.
So those are all, you know, I think that when you're in a room, and you have the tiniest bit of influence, you have to kind of take your shot. So, but I'm very thankful for the opportunity to share our story at this forum. It's amazing to hear the different organizations that were there. You know, we're also looking at ways, you know, how can we do it better and bigger, and I hope that does become maybe an annual project for BRC, because it was something that was of value and a very well attended. I mean, I think even the security there was impressed, because he's like, you almost had 100 folks up there. I'm like, really? I'm like, you're pulling my change. You want me to go there? But he's like, no. He's like, I saw the attendance sheet.
Well, I'll tell you, the work was done, you know?
Yeah.
Stuff doesn't fall from the sky. I'm a praying woman, but you do the work, you're gonna get the results.
And
so.
you guys were so,
We all came together.
We got the mayor, so proclamation, it's official,
Yes.
so thank you for all the efforts, we really do appreciate
Some
that.
of the best heroic stories are stories about human beings who had to contend with barriers and found a way through. Those are the best heroes. And I believe that the people that you presented as people who were successful in their role with the health department or HEB, they're part of our community and they're heroes. And I think especially now, without making a general comment about the status of our society right now, but I think we can always use a hero, and especially now.
Yes.
Especially now. And it's not just for other people with disabilities or families who have people with, but especially like thinking of me from a personal perspective as I get older. Even though I've been director of special ed or been speech therapist or diagnostician or whatever in my career, serving people with special needs. Now as I get older, I'm having a personal experience with what it is to contend with barriers. But these two people were amazing and they're heroes. And they're, we all need heroes to keep on going, keep on trucking. And these beautiful two people that you brought to show us how they're doing, I really appreciated it. I really, truly did. They're heroes, both of them.
They are.
If I may add one piece, a few years back, we've been doing this type of work ourselves as an agency for about 10 years. And there was an opportunity to open up a program, and I had one of my workers call me up in the middle of the day, and he says, are you applying for this program? I said, it's a lot of paperwork, I don't want to do it. He says, but you know, let me tell you a story. He says, I was at the bowling alley working with this customer, and someone came up to me and asked me what I was doing. I explained to them that I assisted or taught the skills, and he says, and he told me I was a hero. And he says, so I kept meddling with the idea in my mind what a hero meant. And so he says, so I'm going to inspire you today. His name is Alonso Martinez. He says, a hero is someone who helps others and helps everyone receive opportunities. He says, that's what a true hero is.
Helps
Everyone receive opportunities. So we created a program within our agency that's called Heroes. And we have a Hero Academy. And the heroes are the ones that teach, and the heroes are the ones that receive the services, because when they go into their community, they open up opportunities. So if anything we can do for Raul, we can give him a cape. Okay? Tell him that he is our hero, because it takes a village to really create a mindset. And it's like I mentioned at the meetings, we all have an innate desire to make a difference. We get more satisfaction. I personally do, and I know most of you will, about watching someone else open up the gift to give them, than you getting money going like, wow, that's really nice. But then you can't wait for Miss Ruthinger to open up first because you gave it to them. That is the most amazing feeling on the face of the earth, regardless of whether you have a disability or not.
True.
So we are heroes.
Yes,
Yes, we are. Okay, so, very good. I wanted to expand on this just a little bit. So Mr. Granados and I have become friends, right? So we're sending the link his interview at with the media, and then of course the picture, and so we've been in communication. And I said, you know, I need to run this by the committee, but I wanna just kind of put this on your lap and see what you think about it. I said, would you be willing for us to do a success story so we could upload to our webpage, right?
Perfect.
And he says, you know what, that would be great. And of course, Bo would be an ideal individual.
Yes.
Well, we're not only highlighting the individual, but the agency, right? So Ms. Erica, of course, would include the health department, so that we can highlight them and put them in our webpage. I think it'd be an amazing idea,
Yeah,
if you all would be good with
No,
it.
I remember that's why we wanted to video it also, because we knew that we were gonna get all these gems that we could put on the website, so I think that's a great idea.
Okay.
And I think he's also been approached by the state to provide some additional information
Good.
on his experience, so that was another result of,
Yeah.
because I know I heard some conversation about that.
Very good. So if you don't mind, I mean, I can run with that. I'll pull you in, and of
Yes.
course Erica, and then,
So we'll
okay,
need Pat then
yeah.
to record, or did you guys?
Yeah, we will need Pat.
Good.
But whatever your recommendations would be.
We could do a
I-
podcast, Jaime.
We could actually.
Oh, still October.
We can like schedule it now, so we can
Yes.
put it on our agenda and get it going.
Wow.
Okay.
Yes, yes, yes.
Even better.
Raul's ears
And we
are
have up
ringing.
to 6 mics now, so we can have, yeah, we can have more than.
That's cool.
I wonder, could you get Samantha here, HEB?
I'll pick her up on my way back from San
So that she could, or even, could we accommodate her virtually to do that?
No, she actually needs to be,
Yeah?
I'll make
Okay.
sure she's here.
So we're gonna count on HEB and both.
Now, it's a great, when she does come down, it's a great opportunity for the city, this committee, to get in touch with her, because what they do is they do something that's extended. They not only hire individuals with disabilities, but they create a fair every year, which, and they bring all the resources for their organization, specifically for the people who have been identified to having disabilities. So that is something that I think would, every organization, UISD
Would
included,
benefit
would
from,
benefit from that.
that we
Okay.
can emulate
And
that.
now ISD, where they create a fair, and the fair, because you're talking about total inclusivity, not only bringing them in, but now providing sustainable resources so that they can grow. Because that's what HEB does. We were just part of their fair in San Antonio.
That's awesome. Okay, next one, the Mentimeter outcomes. This was so much fun. I'm so glad it worked, because we're like, oh, anyone with the connectivity and this and that. And here are the percentages. So 84% lack of awareness and training. So training to be done, right? 55% disability awareness and sensitivity workshops. 58% difficulty in providing customized accommodations early on. 57% would like to see debunked hiring people with disabilities is risky and complicated. 60%, so that means you've got people who are willing, right? 60% least comfortable with cognitive disabilities. And then 44% mentorship and peer support system. So we kind of have a gauge of what the audience was responding, and there's, continued work to be done. And then of course the media coverage, we had Mr. Granados, who did the interview, and the story was submitted to LMT, which was published, so that's a wrap for me, but anyway, that's what that is.
Thank you, Dana.
That's for the one. Thank you.
So our next item is our update on the public health autism surveillance program.
Yes, hi everyone. So I'm here representing the Autism Surveillance Division. Right now we're currently working on expanding our surveillance area. As I mentioned last 2 meetings ago, because it didn't come in September, that right now we're covering Webb County, right? But we are going to cover 2 more southern counties. So that would be Star, Jim Hall, Brooks, Hidalgo, hopefully, and Zapata. So we're hoping to cover kind of the same as what our epidemiology division already does at the health department. We're already in contact with about 5 school districts already, so we should be finalizing it hopefully soon. And then we're going to jump into Hidalgo, which they already have about 10 school districts alone. So hopefully we'll tackle that, hopefully in January, so we can begin that conversation with them. In regards to kind of the work we're doing right now with kind of the data we got already, we're working on the national report with the CDC right now. What this means is that we're trying to find our prevalence numbers and then comparing them with the national average and also with other states, right? We are kind of embargoed right now, so we can't share anything yet, but the information is very rich. It provides a lot of information about what Laredo stands, where they are compared to other national big counties, right? So it's gonna provide a lot of information to hopefully mobilize more intervention programs, bring in more funding. So we hope to share that in March of 2025. We'll be partnering with our leadership team, kind of working on like any press releases, any conferences that we can do to share this information and kind of, you know, disperse it as much as we can to the community. So we'll be doing that, hopefully starting in December, prepping for that to be ready by March. And apart from that, it's something that I mentioned a couple months ago, but it was about that autism needs assessment, if this was something that maybe we can provide for the city as a whole. As I mentioned, there was already a needs assessment that was done in Pennsylvania statewide. I would just need to touch base with our leadership team and kind of share our approach and see if there's something we can do. But it's something that we hope to just see kind of where we stand in services, right? We have the data already, we kind of want to see where we stand on the access of services and what's kind of limited here in Laredo, right? So it's something that has already been done before, so it's nothing we have to replicate and kind of make on our own from scratch. It's something that we can build upon. And it's already been tested before, it's already been published as well, so it is very well vetted by the community. This would be oriented towards parents. Hopefully we can find one that is oriented to personnel and staff and kind of see what's needed for individuals who provide support for families, right? But that is kind of where we stand right now for the Autism Surveillance Division, but we hope to provide more updates as we go along. And then next meeting, we'll touch base about the needs assessment after our conversation with the leadership team and more clarification as to like the methods. How are we gonna disperse this? Do we want to provide copies so you guys can review, see what other questions we can ask, sections to remove, but we can do that in the next meeting after we clarify that.
In Pennsylvania, you mentioned that that's already been done, is that correct?
Yes.
For myself, I would be very interested in finding out what kinds of things were done for what public school people call age-out students. Students who received their education from the public school, but then when they graduate, many times, especially with spectrum students, parents want to know what.
Exactly.
So anytime that you put data together, it's really important to look at historical pieces, in other words, and you've already done that. You've looked at Pennsylvania, they've already gathered data, they've already done surveillance. I'd be very interested in knowing what the kinds of things they did for that population once they graduate from high school. Be very interested in what kind of support systems they have in place.
Yeah, of course, and I think one of the big things about this kind of, you know, assessment is that it is focused on lifespan, right? They want to see what services younger children receive and then versus older individuals, right? Kind of seeing kind of if there's any disparities, if there's any ways we can provide assistance for any individuals, right? Because I know you mentioned the transition piece, that a lot of parents are kind of like, now what, right? So
Yes,
this assessment is going to show like kind of where
and
these
school districts do a transition piece. They by law have to have an individualized transition piece.
Exactly, yeah, and
But what's out there, that's what the concern is.
yeah, of course, and I know, I do have the paper of what they released with this information, but, I will find out kind of what they built from this study, you know, like what has Pennsylvania done now? They did this last in 2020, so I'll go ahead and see what they've done in the past 3 years, and I'll go ahead and bring in the committee so we can review that as well. Yeah,
So
please.
is your program working closely with the school districts?
Yes, we work closely with our local school districts, so UISD and LISD, and we review those IEP transition plans as well. We only focus on those 3 age groups, so 4, 8, and 16. But we do review those IEPs, and we also partner with local hospitals and local providers as well to get more information. So kind of a well-rounded photo of an individual. Like for example, we have a child and we have like their education record, services they receive in the education system, any transition plans, and you know, those transition goals that they have. We also see kind of what they're receiving outside of the school district, if any.
Yeah, post-grad.
Yes.
The most important.
So that you can tell from preliminary information, is there a prevalence, a higher prevalence in this area than nationally?
I don't know if that's something I can share, because it is in barcode. Yeah, but there are complete ranges. So we have a graph that kind of shows you exactly the prevalence that is in California, Utah, Puerto Rico, and it's great that we're seeing Puerto Rico because they kind of have similar demographics to us because of how Hispanic, the Hispanic community is very prevalent here. So I think it's like 97%, I think. It's kind of similar to Puerto Rico as well, so we kind of see those differences and kind of what they're doing over there. But that graph definitely shows it, and then they average it to find a national prevalence rate. So then we can share, this is kind of what nationally we have versus what Laredo has. But there is a large difference there already. But we're very excited to share that information because it's going to, you know, educate a lot of families here.
We have to wait until March.
Yes, unfortunately. But it's definitely something that I want to make sure to
birthday. I'll get it from my birthday.
Yes.
I have a question, how are you gonna disseminate the information? Is it gonna be in a platform where you have speakers, or is it gonna be in
Yeah.
writing? How is it gonna be disseminated?
Yeah, well, that's something that we want to kind of discuss in this committee, if you guys have any ideas, starting in December, because that's when we'll finally have like everything set in stone when it comes to our data. But I know the CDC is doing like a national event, where they are going to do like press releases, and they are going to do presentations already, but we don't just wanna, you know, focus on the CDC of them sharing our information, we wanna also do it as a citywide thing.
Well, maybe in April we can do something.
Yeah, exactly. It's something that we can connect there as well. We can even bring in speakers as well, make a whole event when it comes to sharing this data. We can also share it through press releases and writing as well. And we also have a community report. And this one just goes very in depth into kind of what our data means, its implications, recommendations, any limitations we have with our data, and where there's room to improve, right? So it's like a little book that will kind of give also community members too that might not be able to attend these conferences, might not be reading articles. Hopefully they'll be able to see kind of this graphic booklet that's kind of very visual appealing, has great graphs to follow. That's also another option too. But we can definitely decide it in December and kind of see what's the best approach based on everyone's perspectives, right? I think we have great, you know, important key areas here, so I think we'll find a perfect avenue where to share these.
Yeah, because it brought to mind, the city of Laredo did through Able City, they did a study and about, you know, the accessibility, and that's how they came up with the sidewalks where the bicycles ride and stuff like that. But they brought in a group of individuals from all over, and they brought them in, and there was a public library, and it was a really well attended as a system, and they gave value to what we were doing here locally, but they brought in expertise from the outside that said, okay, you're doing this, great, you can add this to this other one. But this is several years back, probably 2015, 16, maybe.
Yeah, no, I think that's perfect, and I'll touch base with Erica so we can kind of, you know, prepare for that and find a good day so we can start that, and I think that's
Thank you.
If I could just put in my 2 cents quickly. So based on everything that I'm hearing, I think we could piggyback on the momentum through the NDN event, that, I don't know if I said that right, but we have kind of the engagement. One of the survey responses was, I don't feel as comfortable with the cognitive disability.
Right.
So re-engaging that workforce component into maybe an event in April that is, if I'm not mistaken, is Autism Awareness Month. And we'd be able to share results, have some data-driven, you know, and invite families, invite, you know, the public, invite again the employers that attended. Make it maybe, I know there was also a question in this last event of people being able to set up booths. So perhaps doing some sort of like little fair and have speakers and make it, you know, a party would be kind of nice. If you guys are up for it.
Oh, yeah. definitely.
So maybe we could engage UT again if they wanna host again, or if you'd like another. But we have the support of
Yeah.
Kathy's, grant to, we'll ask the funders, we'll ask CDC if we could utilize some of our funds to bring in speakers, and if you feel it's something worth noting to bring someone on a national level in, then that's something that we could explore.
Exactly, and we also have the CDC team that's always welcome to also come in and bring also the expertise as well.
Yeah, when the time comes, we can talk about it.
Oh, right. Okay.
I remember this thing over that she's taking notes.
Oh,
No, it's recording.
It's recording.
Oh, okay, good.
Mhm.
perfect.
That's
They were
smart.
recording at 30, right?
Smarter.
You are smart.
You're losing people by the minute.
I know, just a quick note, we weren't sure Mrs. Zai was gonna be available to meet with us, but we're so glad she's back. So she is able to provide a quick report through your announcements, and then we also had Mr. Angel. Angel is, our new community health administrator, so we're very, happy to have him join. He also comes from, Kathy's group. So people are onward and upward, but that just speaks to the talent that was with the Adam Group, and we look forward to fill those vacancies soon. But we also got word of a new award through Public Health to focus on Alzheimer's. And there's some deliverables we need to meet there, so he was gonna
Much
share some
needed, much
information.
needed, what are we doing?
Yes, so if possible, they can give quick announcements to the next item.
Yes, so we got awarded $150,000 for 1 year. This particular grant has a component where we need to do a community health needs assessment. And we're gonna be preparing the surveys in the town hall, and we just wanted to share that with the committee so we can go ahead and get your support when we disseminate that information.
Absolutely. And also through the Laredo Health Coalition, we can feed that on that platform.
Are you familiar with Joe Arciniega?
No.
He heads, or he's the one who actually started
Yeah.
an Alzheimer's awareness group here in Laredo. His
Okay.
office is actually, you know who's hosting him? Danny Lopez at La Roca.
Okay.
He has an office there,
Mhm.
so you might wanna stop by, get the fish special and talk to him.
But we can pull you in, into, I'm part of the Walk to an Alzheimer's Committee,
Okay.
with Maxine and PV Villaseñor. We can, I mean, you're welcome to join in and tap into, cause Mr. Arciniega is out right now, so
Well,
it's
he
Mr.
said
Dan.
he's
that-
out, but he's
Yeah.
got the list of contacts and all these resources.
Yeah.
So I thought he got the grant, it would be good for them to talk.
Yes,
Sure.
Well, I
Yes.
got it even better.
cause he's a board member at the national level.
He's two
for
doors down
Alzheimer's.
from me at the office. We office in the same building.
Yes.
So I always see him in the stairwell.
Mhm.
So-
I'm glad to hear, because you know, the
Well, when
numbers
Yeah.
are out, right? Laredo and El Paso are tied for number one of
Exactly.
Alzheimer's cases.
Yes.
That's
So,
right.
this is good stuff.
No?
Good job. Not good, but
No,
good
it's good
stuff.
that we know about it.
Yeah.
Information, okay. Then we can move on to the.
Yes.
Why we're so high, the prevalence is so high in Laredo and El Paso. We do share one variable, it's the river.
The river, the diet, the demographics, I mean, we're on, both on the border, there's a lot of.
Thank you all for the discussion.
Yes.
We're on to the next item is announcements.
Okay.
But that was.
Yeah, that was his announcement. Mine super quick. I didn't think I would be back. I was out on maternity leave and had to come back because there was just a lot to kind of do and get. So I just got back, so I'm kind of refreshing everything. The only right now working is a collaboration with the Family and Community Health with Texas A&M AgriLife. She wants to do what they call platicas. I don't know if it was mentioned the last time. She wants to do a platicas with the families, with partners, to kind of how they can kind of disseminate the disability or people with disability information in Spanish and be able to track all those families and include them and see where the needs are, what we need to improve on, what do we need to work on. So that's what we're gonna kind of coordinate maybe the first week of December to be able, and the invitation would be set out to this committee and the individual families and groups to be able to include them as well.
Thank
So
you.
that's what's right now
So
kind of
child,
pending.
boy, girl?
A boy, a little boy.
Congratulations.
So thank you. He'll be 5 weeks
What
on
is his
Friday.
name?
Mateo.
Mateo.
So it's a challenge and the middle night feedings are killing me, but
Is this your
he's
first child?
Yes, he's my
Oh.
first. I have a foster child, but he's a year and a half, and I got him at 9 months, so he's my first newborn.
Yes.
Congratulations.
So thank you. So I'm happy to be back.
Glad to have you.
Happy that you're back. Next item is, can we adjourn the meeting?
Yes.
Looks
I'm
like
hungry.
Somebody move in that direction,
Go ahead, move to adjourn.
second.
Well, I didn't give my announcement.
Ceci.
Oh, wait.
Oh, Ceci has
We
one
have one more
announcement.
announcement.
One motion.
One announcement, February the seventh, not the 14th, February the seventh, Night to Shine, and then Ms. Alduno, who is not here today, is celebrating her 25th anniversary for the organization. We're planning, so we don't have a double, what is it called, event, maybe having a summer event or late, May event for her organization. So she's looking for a venue and people who are willing to participate in celebrating the community and everything. So February the 7th, Night to Shine, and then Ms. Orduno's a time to be announced. So.
And I have one more quick and fast. I know Marta, she's not here, and Miss Amy
Oh,
just
the
left.
walk.
Yes,
Yeah.
but the Texas Workforce Vocational Rehab, Laredo ISD Independent District, and the Blacksmiths Program, we're gonna have our Whitening event on Friday.
Right?
I know some of you guys already responded to Marta and myself that you'll be attending, but just a reminder, if you wanna be there with us, we're gonna be there from 8 to 11 at the Nelson?
Nelson.
Right? Nelson
Dr.
College?
Nelson.
Yes.
Dr. Nelson.
Yeah, it's right next to Martin High School, so we're gonna be talking about the White Cane, so we're gonna be there.
Used to be the Civic Center, guys.
Yes, correct, I used to visit.
Where's the walk gonna be?
It's gonna be there around the.
Indoors or outdoors?
Outdoors.
Okay.
Outdoors.
Very good. We'll be there. We'll be there.
I do have one last question, I promise.
Yes.
The podcast invitation or the details, who do I send that to?
You can send it to me.
Thank you all for your announcements.
Sorry,
Thank you.
Really quick, for the 26th, October 26th event,
Yes.
is there like a registration form or something that I like to fill out? There was something here
For
for the health fair. It says upcoming health fair, BRC is organizing health fair on October 26th.
No, that was October 2nd.
Oh, that was October
Yes.
2nd. Oh, okay.
It was
okay.
a typo.
Oh, okay.
Yeah.
Okay, so that's another typo.
Yes.
Oh, okay.
But then when you asked me, I said point, I was like,
Yeah, I saw, did I read it wrong? I have to go back.
They're in the headlines.
Okay, so then this one
I
too,
don't
and
know
then
what's
that
going
one
to
too.
last week. Okay, any other announcements?
The walking, coming up on Friday.
Friday, on Friday. So what is the actual walk?
The actual walk is just to kind of, for let know people in Laredo that we do have, individuals that are blind, visually impaired, that they use a cane to walk. So just for them to be a little bit more cautious when driving, for them to, because they use their other senses hearing, but sometimes, it's kind of hard for them just to kind of cross the street, just to be more polite. And just to bring awareness just to the public that, they're also part of the community.
But
And
what
they-
time? What time?
It's gonna be from, the event is from 8 to 11, and the walk, we usually have it after the proclamation, the mayor that does the proclamation, probably like around 10:15.
It depends, you have to.
Yeah, like 10:15, around that time.
So it's in the latter part of the.
Yeah.
So are you having like for booths and stuff?
Yes, we're gonna have, organizations from the community that are, that wanna have a booth as well.
Okay.
Yeah, and we're gonna have, refreshments, we're gonna have a proclamation. We're gonna have, the good thing is we're gonna have some students, actual students with disabilities. They're gonna do, some presentations, they're gonna give, they're gonna do demonstrations how to do the white cane. If parents wanna participate, they can also do it, if you guys wanna participate in using a blindfold, so just kind of experience, what a blind individual does when walking with a white cane, you can do it as well. So it's gonna be a very fun event, so, and I see it fun and informative,
Yes.
for all of us. But yes, if you're able to go, and it's free, it's free, you don't have to.
Do you still have space for a table or?
I'll ask Ms. Christine, if she's able to do that, but,
Or I'll send you the information that we can send you. Sorry, I was out, I'm just kinda getting back to kind of see.
but it's
what-
for this Friday.
Yes.
Awesome. Yes, I need the info.
I'll write down my info, that way you can send.
I'll send Ms. Christine,
Yes.
and I'll send you the email.
Yes. Next, I have the children with English special healthcare needs.
Okay, wait there. So who's gonna second? Ceci first, and you need a second, right? Dr. Rudiger. Okay.
When you come